Flushing and heparin locking your central line. Flushing and heparin locking of a central line should be completed in order to maintain a functioning central line when not in use. Clean means using routine hand washing, regular gloves, and measures to reduce infection. We use clean technique when changing caps, flushing, and handling central lines. How often must the line be flushed and heparin locked? Central lines should be flushed with heparin every 24 hours at home. If the central line has more than one lumen, each lumen should be flushed every 24 hours. Supplies for flushing and heparin locking a central line. You will need clean gloves, a saline flush, a heparin flush, and 1 to 2 alcohol swabs. Double the number of supplies if more than one cap is being heparin locked. Always begin by sanitizing your workspace surface to make the space as clean as possible. It is important to use disinfecting wipe as directed on the product container. Be sure to use enough wipes so that the surface you are cleaning remains wet for the specific length of time to kill germs effectively. Preparing to flush the line. You should always wash your hands before doing central line care and put on a pair of clean or regular gloves. Position your child so their central line is easily accessible. Prepare saline flush and heparin flushes by removing them from packaging. While maintaining sterility of both flushes, remove the small air bubbles from syringes. Take off the cap on the end, hold the syringe vertically, and push the plunger until air is removed. Replace the end caps as clean as possible. It is very important to do this because we do not want air entering the line as it can cause complications for your child. Cleaning and flushing the line. Take an alcohol swab and clean the end of the cap on the central line for 30 seconds. Let it dry completely. Then, take your prepared saline flush, remove the end cap, and attach it to the end of the cleaned cap. To attach, press the flush firmly against the cap while twisting it to the right until it is secured. Unclamp the lumen. Flush 3 to 5 mL of saline. Carefully disconnect the saline flush and attach the prepared heparin flush. Once the heparin flush is attached, flush 3 mL of heparin into the line. Clamp the lumen and disconnect the heparin flush from the end of the line. If the lumen touches something or becomes contaminated at any point, re-clean with your second alcohol swab for 30 seconds and let it dry completely before continuing. Repeat these steps for any additional lumens that require flushing. Your central line is now heparin locked.